Hello, class. This is a wrap up of week 2, chapters 3 and 4. I'll go over the Athlete Insider case study in each of the chapters, and I'll connect it to new theories that we presented in week 2, as well as the evidence based practice literature in each of these chapters. So, first, let's take a look at the Athlete Insider in chapter 3. And this is Susan. She's that college softball player who tore ACL, has a successful recovery, and is now coming back to her first game and tears her ACL in that first game back. Now, in looking at the Anderson and Williams model, it's still a widely used model today, even though it's 1998 at its creation. It helps us to look at Susan and her history of stressors. She's been injured before. She's having arguments with her significant other. And then her coping resources are listed as extremely low. Her social support system, namely. Then we put that potentially stressful athletic situation of returning to your first game back following a lengthy recovery. And your preparation for that, you're really needing those coping resources, that positive framing, etc., of that situation, that first game back. So here she comes, her cognitive appraisal of, she's already told the athletic trainer, hey, I'm really nervous about this. Red flag should go up there. We should be thinking as clinicians, have I asked this athlete, have I taken the temperature of the water daily, weekly? We see athletic trainers see athletes on a daily basis. And a physical therapist, occupational therapist, they see patients less often. More important, potentially, to take the temperature of the water each time you see that patient. For example, when an athletic trainer is taping an ankle, how often do we, now let's say we got 50 to tape and we have 35 minutes to do it. We're thinking, oh my gosh, the fastest I can do it is 30 seconds. I got to keep cranking. So we keep our head down and we tape and we tape and we tape. How often do we lift our gaze, look at the athlete and say, how are you doing today? What's going on? Any new stressors in your life? How often does that conversation occur? I just want to challenge you to think about that. And a lot of you commented this week in your discussion posts on spending quality time as your love language and what kind of time you spend, whether that be just sitting doing menial tasks next to the patient, or whether it's engaging with that patient, talking to that patient. Quality time doesn't necessarily mean just you being present. It's looking at that patient, connecting, engaging, active listening. So thinking about that and how we spend time with our patients, do we even know if the patient is stressed? This week also, we introduced you to various stress inventories. So think about how you might incorporate those into your care, how you might utilize those. What are some signs and symptoms of stress? Those were included in one of the inventories, the one that's used with military civilians. I think that we all need to have those on our radar when we're treating patients. And if we see those signs and symptoms, if we hear them from the patient, if we see those, if we observe those, then time to whip out an inventory and take a look at it and see, oh my gosh, you're so stressed. Let's back off this physical rehab today and let's look at some relaxation, some breathing techniques, some coping measures. So as a clinician, we stand to change the patient's mental well-being. And it may not be directly connected to their shoulder or their knee or their wrist, but it is directly connected to their success and their rehabilitation with you. So in thinking about Susan, back to the Athlete Insider, her situation of returning to play, her appraisal of that event, she's already got peripheral narrowing. If you read that article this week, that was in additional readings. Stress disallows us to pay attention to everything we need to in our environment. And it narrows our vision to only the dire needs, only survival needs. So this may lead to injury in a team sport or in an individual sport. So we have injury here over here depicted as a result of a challenged cognitive appraisal, too much going on. Now, can an athlete return to sport and not experience re-injury? Absolutely. In this case study, she's overwhelmed. It's not a good time to return her to sport. And the athletic trainer in this case study is the person to notice that and to modify that athlete's return to play plan and to wait. Wait until that athlete is solid mentally and physically to return to play in hopes to limit injury. All right, so that's the Athlete Insider number 1. Now, I wanted to address an evidence-based practice article, Madison, 2005, and although it's 11 years old, 2005, this study is still referenced today as stress and lack of coping measures correlate with injury. So it's not rocket science, I guess is what I want to say. We want to minimize anything we can. And if you look at the cognitive appraisal model, stress is something that we can minimize. We can teach coping skills to our patients. So think about that. Now let's take a look at the Athlete Insider in Chapter 4. So the Athlete Insider from Chapter 4 is Marin. And if you remember, she's the basketball player who injures her knee pretty extensively, and then it misses her entire senior season. And the key piece here, a lot of stress going into this situation in a sense of her college career, her college education rides on her ability to play basketball. So she's been heavily recruited. There's a lot of pressure in games for her to perform, and then she gets injured and becomes not clinically depressed, but is showing some depressive symptoms that the athletic trainer, physical therapist, occupational therapist, her care provider picks up on. So in this case, Marin has appraised her season-ending injury, or her maybe even, she might perceive this as career-ending for her, as extensive and is lost, feels isolated, disengages from the team, all of these things. So what I have on the screen is the cognitive appraisal model modified version from Wise Barnstall et al. And this version is the version that was created to cover concussion care. And I'll post that article under additional readings this week if you want to take a look at it. Here we see the effective symptoms and responses and things that we need to pick up on as care providers that are maybe atypical of our patient or that have changed since that patient has begun treatment with us. When we see these signs, oftentimes it's important to get other providers involved. If it's a high school athlete, a school psychologist, a counselor, if it's not and they're just a general community member, communicating with their physician, their team lead in their medical care and letting them know that you are noticing this. As a therapist, you're likely in most contact with that patient compared to physicians or the individual leading their care. So it's important that we open those lines of communication to ensure that the patient has the optimal chance of recovery or the best chance to recover. So in the case of Marin, providing social network for her, the athletic trainer in this case connected Marin with the athletic director and had her shadow the athletic director, and it turns out that's what she wants to do. She thoroughly enjoyed that. She wore a different hat, so to speak. So she put her athlete hat aside and she put a different hat on, that of a mentee, and learned a new role, and then ended up going to school to pursue a degree in that. So at the end of the day, good story, good case, showing how we can refocus energies, how we can keep that individual engaged with their sport in a different way. And we can parlay this across patients. If a patient is a gardener, if a patient is a factory worker, etc. Finding out what drives them and then connecting them with that support group or that activity is often a way that we can enable patients to have a successful recovery, although they may not return to previous states. Okay, so that's chapters 3 and 4, and I want to make sure that you are taking a look at these Athlete Insiders because they give us a chance, an opportunity to apply some of the skills in that chapter and then previous chapters to take a look at that case and maybe even think about cases that you are experiencing in your current position. Okay, so for week 2, I hope that you... One additional wrap-up item for week 2 is the stress inventories and making sure that you print these, copy them, save them, so that you have them to utilize in your current practice, or have them to utilize with the students that you're educating, our future clinicians, so to speak. Save these resources, employ these resources. We already talked in our voice thread about where you think you're going to use these or which ones you think you may use. I would have that signs and symptoms of stress under my desktop. I would have it available at all times so I can glance at it, pin it on a board behind your desk, whatever it is, and then have some of those inventories. Choose the one that fits best your population. If it's a daily or a chronic stress assessment, or if it's a college student stress assessment, definitely a different group. There may be some others out there as well that you would be interested in utilizing. So I encourage you to do so at this time. Gather those. If we wait, it tends to get lost in the sauce and we don't do it. So try to go ahead and do that now as you conclude week 2 of our course.